Zucker Hillside Hospital is Northwell Health's nationally recognized behavioral health center. We're proud to be renowned for our pioneering clinical, teaching, and research programs. At Northwell, we care for all of you, body and mind. Look north.
Zucker Hillside Hospital established a Nursing Research and EBP Council with a group of 16 inquisitive nurses from bedside to management, including our Chief Nursing Officer. The first thing that the council did after it was formed in 2016 was to establish a Nursing Research and EBP corner on all our 10 units for communication about nursing research and EBP activities and initiatives to all employees at the hospital. As soon as the council received a Train the Trainer workshop from Dr. Lily Thomas and Dr. Mirtha Rabinovich, as well as our librarian Janice Lester, it took an ambitious initiative to provide EBP competency to all our nurses at Zucker Hillside. With the support of our visionary and transformational leadership of Mary Beth McManus, our CNO, Zucker Hillside Hospital became the first hospital in Northwell Health to complete the EBP competency training to all the nurses in 2017. EBP competency is now in the orientation syllabus for onboarding nurses. Because there has been heightened enthusiasm in research and EBP, Zucker Hillside formed a Night Nursing Research and EBP Council in 2018. Currently, we are working on effect of lavender in improving sleep quality in hospitalized behavioral health patients, efficacy of a web-based mindfulness app in reducing stress of nurses, humanism and effect of recovery-oriented cognitive therapy on inpatient behavioral health unit. Our next steps are to boost a culture of evidence-based nursing practice at Zucker Hillside, where nurses will look for new and best evidence in planning care for our patients.
I am serving as the principal investigator on a research study evaluating aromatherapy. More specifically, the effect that the scent lavender has on inpatient sleep. We plan on utilizing visual analog sleep scales to measure patients' sleep in their first few days on the unit. Although my study has not begun, while preparing for the study, my team band together and began the necessary steps to conduct research on our institution. The nurses of One North began taking city training at home and on their spare time at work. We gathered together to understand the material city training was teaching. One North nursing team showed great teamwork in supporting this new research project, and we are very excited.
I'm the site PI for the multi-site study on the efficacy of a web-based caregiver-specific mindfulness app to reduce the stress level of nurses. As an RN with no past experience in research, I was initially skeptical about how to proceed. Working with the Nursing Research and EBP Council and the multi-site study team, I gained confidence on each step of the research process and taking the lead in conducting the study at Zucker Hillside Hospital. The nurses at Zucker Hillside work in a very busy and often stressful environment, providing the best care possible to the mentally ill and behaviorally compromised patients. I am hoping that through the mindfulness study, my fellow nurses would be given an effective path to manage stress or keep it under control. I am also hoping that this study will shed light to millions of nurses worldwide on stress management and improving care to their patients.
Being a member of the Research and EBP Council has made me look beyond the status quo of what is and what could be. Having received a training in EBP and having worked in the ZHH Nursing Research and EBP Council, I am inspired and motivated to search in systematic reviews and in meta-analysis for the best evidence available that my team and I could apply in our practice. The Council encourages our team to critically examine the processes and practices that have been our norm and look for improving them based on best available evidence. The Council also has created a spirit of inquiry and created an environment where nurses can conduct research studies to generate new knowledge to improve patient outcomes and nursing's professional practices. It also encourages me as a nurse leader to propel my staff forward, to have the spirit of inquiry, and to always ask the question about the process and or the problem we encounter, and to look at the interventions and outcomes.
Literature review indicate that there is a big gap between research evidence and the implementation of evidence into practice for better patient outcome. There is also available evidence that Journal Club is an excellent method to expose useful literature to clinical practitioners and Journal Club participants, increase their knowledge and evidence-based practice. With the strength of this evidence, we initiated a Journal Club at Zucker Hillside Hospital. The Journal Club meets every fourth Wednesday for an hour. Published journal articles on topics of current relevance are discussed. An example of topics is occurrences of patient falls in the behavioral health. Evidence of available in literature were in our discussion, and specific evidence have been integrated in our nursing practice. Implementation have the interventions have a significant contribution to the reduction of falls at Zucker Hillside Hospital.
I'm a registered nurse on 1 North, where most of the patients are admitted due to affective disorders. A recent change in our clinical practice was to have a closer look at both patients' spiritual and religious needs. Synthesized summaries from systematic reviews and meta-analysis of randomized controlled clinical trials evidence that integrating patients' spiritual and religious needs is very important and might have significant effects on depression and anxiety. So what we did was we included a detailed spiritual and religious assessment upon the patient's admission. And being the chairperson, the CCC chairperson of 1 North, I'm very proud to say that addressing the spiritual needs of our patients have significantly helped them. Their response to the patient experience question on spirituality went up appreciably.